let's talk a little bit about all the changes that have come out from CMS, right? Especially around telemedicine, and how much has that helped you both do what you need to do, both do your work?
Sure. Well, certainly the easing of regulations around telehealth and the ability to provide care that couldn't be done through telehealth before has been tremendous. I mean, the loosening of the regulations and the ability in hospice, for instance, recertification can now be done through telehealth as opposed to having to go out and see the patient in person. So that is certainly changed the dynamic. It's created a safer opportunity and environment for the patient.
They've acted very quickly in a lot of flexibility, remarkable speed to change regulations that allow us to keep taking care of people. You know, the telehealth billing and coding is one. I would highlight that they cleared nurse practitioners and physician assistants to certify to do home health. So that makes home health care more accessible to more people who need it. And there's been a kind of a speed with which they've acted that the government is not always known for. So I think CMS deserves some credit for making those changes as quickly as they have.
Yeah, I would just add to that as well, Eric. I'm glad you brought that up. It's been tremendous, actually, in a very short period of time to act as quickly as they have to address these issues and to really get through a lot of complicated regulation and ease that in a way that makes it very effective very quickly has been pretty tremendous, I think.
So obviously, we've had a lot of changes that have been supportive, but as the pandemic resolves over the coming months or however long it is, do you foresee those changes going back?
Yeah, I think there may be some going back, but I think there'll be a very methodical and thorough review of what's worked and what hasn't worked. And so my hope is that the success of the use of technology and the use of the approaches that have been taken as a result of won't just automatically go back, but that there'll be a real review of what's working, what's not working, and really focus on continuing to allow those things that do work well to continue.
And James, I would add that I think what CMS might worry about is people are going to game the system and just run up a lot of bills and not do appropriate care. And what I would suggest to CMS is hold health providers accountable for results. So pay them not based on every single box that you check, every single televideo visit that you do, make that allowed, but really reward providers based on their cost savings, on the quality of the patient and family experience, and shift the value-based payment faster than kind of the old fee-for-service system, which can always be gamed by people who want to make extra money.
Yes, exactly. And I would agree completely, Eric. And I think, in addition, and to go back to one of the questions you asked earlier, James, there is no substitution ultimately for, in-person care. I mean, the person-to-person touch and, the issues around social isolation that we're seeing that are really developing in a very serious way, while some of them can be addressed by technology, it's no substitution. So I think you have to carefully look at the balance. How do you make sure that you continue the direct care, the in-person care, the human-to-human touch, which there is no substitution for, no matter how good your Zoom video is. And those are the kind of things that we'll have to carefully assess and make sure that balancing occurs.